Next one is our SSRIs, which is pretty much our serotonin reuptake inhibitors. We're blocking the reuptake of serotonin. Now, if you guys didn't see the first video and you're jumping right into this lecture because you're like, I have an exam tomorrow and I'm pulling my hair out and I need help, calm down, just relax, okay? You need to watch the Patho video first. This is not going to make any sense because you don't want to memorize everything. You want to understand everything. You can cram for this test and still fail the NCLEX. So guys, relax. Watch that little 10-minute video, then watch this one. So your SSRIs blocks your serotonin reuptake. So fancy words for we're blocking the communication telephone game, okay? So it takes a lot longer for our SER, serotonin, becomes very slow. So sleeping becomes a problem, emotion becomes a problem, remembering becomes a problem, as well as appetites, sexual behavior, and muscle tone, which is all in that Patho video. So before we get into this, let's get into our most common ones here. You guys can pause the video if you need to and write these down. But guys, right here, these two are the most common ones you will see. Prozac and Zoloft. And you'll see those little commercials with cartoons for it. If you have suicidal ideations or antidepressants, may be right for you. Consult your doctor today. Like those kind of things. Prozac and Zoloft will be your dealio here, okay? So you can pause the video, write those down if you need to. If not, we're moving on. Your SSRIs. So remember, it's SSRIs, okay? Serotonin. We're blocking the reuptake of your serotonin. And I'm going to get to exactly all the side effects for that. But we're using this for major depression, as well as 2 anxiety disorders, OCD and PTSD, as well as it can be used for bulimia. And now you're thinking like, oh my gosh, not only is it an antidepressant, it's used for anti-anxiety, and now it's used for eating disorders. And you're like, guys, relax. We're really just trying to accomplish specific things with medications. Doesn't always have one reason to give a medication, okay? So remember that SSRIs are mainly used for antidepressants. They can be used for anxiety disorders like OCD, PTSD, as well as bulimia. And now you're thinking bulimia, why bulimia? Well, let's get into it. Now, if you guys remember from the Patho video about SSRI's neurotransmitter, you would remember that sleep, emotion, and remembering is one of the attributes of SSRI, as well as SSRI functions as decreasing your appetite, decreasing your sexual behavior, and also your muscle tone. So, if we give an SSRI, we're slowing down the response, the communication telephone lines, okay? So we're basically slowing down your patient's sleep. They're going to be having, they're going to be awake more because we're slowing down the sleep. So I don't know if using those double negatives makes sense, but that's why with our patient education, we're taking it in the morning, taking the AM. We're avoiding caffeine that wakes you up because we're turning off really one of the neurotransmitters, well, not turning off, but we're slowing down one of the neurotransmitters that helps us sleep. We're also slowing down one of the neurotransmitters that helps us to have emotion as well as remember, okay? So with this, we have side effects like our headache because we are slowing down neurotransmitters of serotonin in our brain. You have GI upset because 80% of serotonin is in your GI tract, helping peristalsis and smooth muscle. So if we're slowing that down, we're pretty much putting a slow on your GI tract, and it can cause your GI tract to be upset. You also could get urinary retention. So we're telling our clients to use the restroom before they take these drugs so that we don't hold on to any urine, okay? We're also decreasing more sexual arousal. What? What? It's one of the biggest complications that you'll probably see on your test, because sexual arousal is one of the only side effects in all the drugs that SSRI is different. So that's really one of the main reasons why patients switch to other antidepressant drugs. Usually they're switching to, what's it called? Wellbutrin, which we'll get into. What's called an atypical antidepressant. Okay? Now, two more here. Weight gain and also complete blood count platelets, fancy words for bleeding, and I'll get into this here. But really we're just taking from our PATHO video because we're decreasing appetite. So if we're given an SSRI that slows that down too, we are causing your patient to gain weight or could gain weight. Now, initially, this is a great test question. Initially, weight loss and then weight gain is a problem. So weight loss first, then weight gain later. Problemo. But we'll get into that now. For your CBC, or your complete blood count, we have something called your platelets and your coagulation time. Now remember from the PATHO video, guys, your blood platelets need serotonin because binding to clots and vasoconstriction are needed for platelets to pretty much stop your blood, basically stop you from bleeding out. So when your patient is bleeding, platelets stick together and form clots, and vasoconstriction helps less blood flow to the area. So less blood flow means that your patients will stop bleeding more. That's why we put like ice on your wound, vasoconstriction. So for your CBCs and platelets, serotonin is needed for these platelets to stick together. Now there's a whole bunch of other stuff that's needed as well. But you could have risk for bleeding, which really gets us into our next patient education right here. So that's why your patient's at risk for bleeding. So for risk for bleeding, we're educating your patient. Don't use shavers. Use razors. Watch out for brushing your teeth. You know, that kind of thing. Along with the other labs, we have liver issues that come along with serotonin, SSRIs. We already went over sexual dysfunctions. That's the big one. If you guys remember anything and take something away from the SSRI videos, remember serotonin and sexual dysfunction are pretty much the big ones here. So some of the other minor ones are your central nervous system stimulation. We're not doing coffee, guys. It's pretty much turning off our sleep mechanism. So turning off the sleep mechanism turns on the awake mechanism. And pretty much fancy words for, or I'm sorry, your book will say fancy words for your central nervous system stimulation. So take in the morning, no coffee, and also weight loss initially, then you're getting weight gain because serotonin helps to suppress your appetite initially, then you end up gaining a lot of weight. Now, real quick, let's get into our drug-to-drug interactions here. We have our MAOIs, and obviously MAOIs do not mix well with anything. But when we have MAOIs, TCAs, as well as lithium, and we'll get into lithium, that's our bipolar medication, we have an increased risk for what's called serotonin syndrome. And all this serotonin syndrome means is that we are lacking and stopping and slowing down the communication of the serotonin, slowing down that sleep, emotion, and remembering. So your patient's going to have more confusion, more anxiety, possible abdominal pain. Why? Because 80% of serotonin is in the GI. And then also possible tremors and sweating. This is a very serious issue here. So serotonin syndrome, anxiety, confusion, abdominal pain, tremors, and sweating. Your test might have that on it because that's a toxicity issue with SSRIs. So hopefully we didn't go too fast for you guys.
You can get your life back and stop those all-night study sessions, featuring our new pre-lecture videos and follow-along study guides that highlight the book for you. You can study anywhere at your own pace with our PC, tablet, and mobile software. Join thousands of successful students already using SimpleNursing.com and get to your goals faster. Less stress and more success. Get started today. Join now at SimpleNursing.com.